chair for the National Pancreas Foundation, and this is my story. Many people have known somebody with pancreatitis, but few are familiar with what that really means. It's when the pancreas becomes inflamed from many different factors, and with our family, it's hereditary. So, and it's when the pancreas tries to digest itself, and that's what it feels like. It literally feels like your pancreas is trying to eat itself. So it's accompanied with nausea and violent vomiting and severe pain in your stomach and in your back. Me and my son, my younger cousins, my great-grandmother, my great-uncles, my mom, and my niece all have it. My son's symptoms began before he was 3 years old. He'd cry with pain, he'd vomit, he'd have a fever. We'd take him to the doctor, and the diagnosis, they would always say, would be constipation, or even once, at 5 years old, they said he had kidney stones. Hereditary pancreatitis was determined through blood work at 5 because his cousin was about 2 years older than him, and he had pancreas fluid in his lungs. My mom was 11 when her symptoms first started. On one occasion, she went to shock from the pain. It still took years for her diagnosis, and it took far too long for my diagnosis and many other family members as well. It has been discovered that our family does have the PSSR1 and CFFR gene mutation, which puts us at high risk for pancreas cancer and cystic fibrosis. My diagnosis at 17 as well changed my life from being a normal teenager to an isolated hospital patient. I lost over 30 pounds in a month because I couldn't eat without vomiting or without pain. On one admission, I could see my classmates literally out the window from a hospital bed at UAB. The first protocol back then would be stop eating by mouth, so you would have an IV literally for a week, and that's it. Not a sip of water, nothing. As I got older, I often had pancreas flares that would put me in the hospital. They attempted 2 unsuccessful pancreas stents. Things intensified when I was 5 months pregnant. I got sick one day from simply eating an orange, and I was continuously sick and in the hospital till my son was 5 months old. After his birth, my health kept declining. My liver began to fail, and I was transported to a more advanced hospital. One thing I learned from when your body is failing and you're turning yellow is no one wants to tell you till you make the discovery. After a few failed stays back home, they put in a feeding tube through my nose and then a more permanent one through my stomach. They remained for more than a year. It ultimately gave my pancreas the rest it needed without food and drink intake by mouth. Things then started to improve some. My pancreas now only works about a third, so I require pancreas enzymes every time I eat to help digest my food. I'm reactive hypoglycemic, so that means if you eat carbs that your blood sugar will go low, so you have to eat protein and fats with it. And then back in September that they realized my spleen had a blood clot in the hepatic duct, and so they had to remove my spleen. And of course the surgery didn't go as planned. It was supposed to be robotically, and they were putting in the last staple, and they hit a vein, and I started bleeding out, and I got 2 bags of blood. So pancreatitis has completely changed the way people live. It causes unimaginable physical pain, vomiting, other organ complications, mental distress, infectious, diabetes, failure to thrive, and even death. It keeps us constantly on edge, wondering will it strike again and what we can do to prevent it. It has no cure, and the symptoms they struggle to treat properly. Pancreatitis research needs more funding and a cure so it can become a thing of the past and not with us in the future. So this is my story, and I appreciate y'all's time, and I hope that y'all can at least learn from this when you think of pancreatitis that you know that it hurts and there's no known cure. Now my son will give his story. Joseph
Hello, I'm Joseph Gorman. I'm from Anion, Alabama. I'm 17 years old. My mom focused more on the physical side of it, and I'd like to focus more on the mental side of pancreatitis. When you're in the hospital for a week, you don't have really anybody there with you except your mom, and while all your friends are outside and they're having fun together, you just kind of sit there and watch the videos that they send you of them celebrating stuff together and having fun. And pancreatitis has gave me depression and anxiety, and through all of that, I've still managed to embrace myself and embrace being different. And during my stay in the hospital, the one thing that I've learned is, through all the hard times, to get through it, and even during my episodes that I have, to embrace the little specks of hope that you see and everything around you. You should embrace the bad and embrace what you are instead of hiding it and trying to be like everybody else. And it's normal to be confused on why you're this way, but you still should push through yourself. Thank you.
Thank you.